All right. So shoulders. What we checking in the shoulders: internal rotation, external rotation of the shoulder, and extension of the shoulder. So what we usually hear, let me show for the camera because she's right here, right? All right, perfectly. So we place this arm and in 90 degrees. So you see 90. I a little bit support. I don't push too hard down. It just light attachment. So if she start raising, I not let her do it. Now I ask her to slowly raise this arm up like palms, and I will looking for 90 degrees. And she's like, let me see the. Yep, I think you can see it on the camera. No, it's not there. So what I'm doing here, I help her out, and it's actually going, but really restricted. I would say she have some. You feel that click? You feel that click? Okay, she don't feel it. I do feel it. I did feel it. Now I want you to ask her to turn this way, towards my. So she's really good up here. Don't. No. She's like cheating. Okay, go ahead, try around. And you see a little bit compensation, but she's good. So we're looking for 60 degrees. She limited and your external rotation of the shoulder, but internal rotation is actually over limited. So that's mean maybe she have some issue here in her the yeah the scapula is slide off and forward. That's most of the cases because people start that hunch forward shoulder. Now extension of the shoulder. So bring it arm up here and ask her to raise this arm up as far as possible. Looking for 45. It's limited. Make sure it's straight, and I can go, you see, without any problems. I can push to this 50 degrees. This is what we're looking for. Let me test the other one. So we have external rotation of the shoulder problem and motor control of extension of the shoulder. Now we're going to ask to move this one up. This one is a little bit better. How do you feel? This one better? Yeah, so I can get there for sure. It's limited. Let's go this way. Okay, yeah, she's one of those who over those angles. And look at this. Go ahead one more time. And that's really good. Yeah, it's really close. If you're not sure, you can measure it with a chronometer. So what I'm looking for here, I see this rounded back, and I really want to work on that. It's maybe help our neck. So we already showed this in our past videos. Take a look how we do work on our thoracic area. I can show one, my favorite. It's rib springing. So or Texas twister that Eric Dalton called this one. So I'm not pushing on the spine. I found the spine, and I place my both hands kind of in this position. You see, and what I'm doing here, I ask my client start deep breathing and relaxing. And what I'm doing, I'm just springing a little bit, very gently. And I remember my clients have scoliosis, so I'm always asked the question with my clients, my history. A lot of people don't want to feel the history form, but this is really important. If you really take care of your health and you want to know more about yourself, you always answer those questions. So if people ask you, how's it feel? Feel good. I don't push too hard. Okay, you feel comfortable? She can't breathe. It's too good, so she can't breathe. No, I think she's. Take a deep breath, everything out. A little shake her. So, and you can do this around 30 seconds. You can rocking people. You can rock back to forth. You see, her problem. I think she's really restrict herself. It's not the muscle. I think it's right in here. The problem is there. It's just she's guarding everything. Look, now I want to shake her up. Try to relax. I don't mean she's crazy in the head. It's not that. It's just the people sometimes don't know the brain is limited. the movements because they don't use it, or it's too much compensation. So I'm rocking all the time to make sure my client is relaxed. Allowed me to work on it. If people come in and with the spasming muscles, and what we do in here, we just take that elbow and go right away in that muscles, and yeah, it might be feel good, but we do more damage. We want our clients is relaxed. You see, my client, she constantly moving, do all that stuff. It's tell me, I think she might be under stress, and that's not good. And I know she's under stress. That's why when we're under stress, we start shrugging our shoulders. And let me go this. You just don't talk right now. What the hell? She brought the phone. Oh my god, it's so bad.
I'm not under stress.
Yeah, she's like, her phone is in her way. People get crazy about this phone stuff.